An ambulance officer has told News Hub patients' lives are at risk because she's forced to respond to call-outs on her own. As Jenna Lynch reports, a survey of health workers has found 9 in 10 are worried they can't give Kiwis adequate health care due to underfunding.
This ambulance officer doesn't want to be identified. She's speaking out against the government. She works in rural New Zealand, which often means staffing an ambulance by herself. She recently had a patient suffering a cardiac arrest and had no choice but to call on the patient's wife to help her.
I said to her, watch what I'm doing because you're going to have to do this so I can do other things.
The patient's wife had to perform chest compressions while the ambulance officer administered oxygen and tried to use a defibrillator.
He tried so hard to stay alive. His wife tried to keep him alive and so did I, but unfortunately everything was stacked up against him.
She's just one of many health workers that don't think they have enough resource to give Kiwis the health care they need. A survey of around 6,000 health workers found 90% didn't think there was enough staff or resource. 84% thought workload had increased over the past 5 years and 72% thought their workload was unreasonable.
This is a concerted speaking out by those who are at the front line, and no government can ignore that.
The Prime Minister says, "We hear you, watch this space."
Discussions are underway right now about the next budget. So, yeah, we do pay attention to the views of people who are on the front line because they're a pretty good measure of what's happening.
But the rural ambulance officer thinks it simply can't come soon enough.
I shouldn't be in an ambulance by myself.
Bill English clearly knows the health system needs more money. The last thing he wants in election year is an outcry from overworked health staff. But they'll have to wait until budget day, May the 25th, to find out if the government has really listened to their concerns. Jenna Lynch, News Hub.